There are over 578,000 Nevadans across my state enrolled in Medicare, and their hard-earned Medicare benefits provide coverage for their health care expenses. The problem is, when I travel around my state and I speak to seniors, the number one thing that I hear about is how difficult it is to afford the prescription drugs that they need. Let me give you an example. Sue Bird and her husband Tom, they live in rural Nevada, in Fernley, Nevada. Tom has diabetes, and even though they are both on Medicare, covering all their health care expense costs them nearly $1,000 a month. That can be crushing for two retirees on a fixed income. The stress of Tom's diabetes alone affects his blood sugar, but add in the worry over the price of their medication, their dental and vision, and other healthcare costs, and it becomes almost too much to handle for them. So why are Tom and Sue's medications so expensive? I'll tell you why, and you've heard it from my colleagues over and over this afternoon, because year after year, Big Pharma has decided that they need to jack up the prescription drug prices, all the while their executives are raking in millions of dollars in profits. These pharmaceutical companies are driving higher prices. They're forcing millions of older Americans to pay more in premiums and out-of-pocket costs. You know, our seniors made this country what it is today. Tom is a fourth-generation Nevadan, and we really have a duty to ensure quality, affordable health care for people like Tom and Sue and seniors across the country when they retire. That is exactly what Democrats did when we passed the Inflation Reduction Act. We capped the cost of insulin at $35 per month for people with Medicare. We made vaccines free to seniors, and we're holding drug companies accountable for raising their prices faster than the rate of inflation. And now you're hearing, in a major victory that's been decades in the making, we finally gave Medicare the green light to negotiate lower prescription drug prices directly with Big Pharma. This is going to make a huge difference for Nevadans and for Americans across the country. The Biden administration just selected the first 10 drugs for price negotiation under Medicare Part D.
Well, friends, these changes could affect millions of Americans. President Biden has made it clear that he wants to make 4 big adjustments to Social Security. This will include increasing monthly benefits for select households, but new analysts show his plan would fail on multiple fronts. My dear friends, please make sure that you watch until the end of this video, especially if you are a retiree or a senior. Also, to say thank you for being part of this community. Every Friday, I will be announcing several winners for the Walmart gift card giveaway. If you would like to enter these weekly giveaway, friends, please click and like several of my videos, and then comment below the keyword of each video that you watch. The more videos that you comment on, dearest friends, the greater your chances of winning the giveaways. In July, nearly 50 million retired workers received checks from Social Security that averaged about $1,838. While this represents a fairly modest monthly payout, it has proven vital for the vast majority of retirees. For more than 2 decades worth of surveys from National Pollster Gallup, it shows that between 80% and 90% of retirees lean on their Social Security income to various degrees to cover their expenses. And without this program, the poverty rate for our nation's seniors would be significantly higher. Yet in spite of Social Security playing a big role in the financial well-being of our nation's retired workers, the foundation of America's top retirement program has begun to crack. Fixing Social Security should therefore be a priority of our federal government. Prior to being elected president in November 2020, then-candidate Joe Biden released a multi-point plan to overhaul Social Security. His plan contained 4 core elements designed to increase taxation on the highest earners and boost benefits for those who need it the most. The trustees' report estimates that the Old Age and Survivors Insurance Trust Fund, which was responsible for doling out benefits for retired workers and survivors each month, is on track to exhaust its asset reserves by the year 2033. If the OASI's asset reserves were to run out, sweeping benefit cuts of up to 23% may be necessary to avoid any further payout reductions through the year 2097. The headline change of Biden's 4-point proposal is to increase payroll taxation on the rich. In 2023, all earned income between 1 cent and $160,200 is subject to the 12.4% payroll tax. Meanwhile, earned income above $160,200 is exempt from the payroll tax. Approximately 94% of working Americans pay into Social Security on every dollar they earn. Biden's plan calls for the reinstatement of the payroll tax on earned income above $400,000, as well as the creation of a donut hole between the maximum taxable earnings cap and $400,000, where earned income would remain exempt. The key here is that the maximum taxable earnings cap increases in lockstep with the national average wage index over time. So in other words, this donut hole would eventually close after a few decades, making all earned income subject to the payroll tax. Another big change offered by President Biden is to replace Social Security's measure of inflation. Since 1975, the Consumer Price Index for urban wage earners and clerical workers has been responsible for determining the program's annual cost of living adjustment. The problem with the CPIW has been seen in its name. Tracking the spending habits of urban wage earners and clerical workers does not make much sense when these are typically working-age Americans who are not currently receiving a Social Security benefit. Biden has proposed switching to the Consumer Price Index for the elderly, which would solely focus on the spending habits of households with persons aged 62 and over. Such a move should lead to higher annual COLAs. Joe Biden's third key Social Security change is to increase a special minimum benefit for lifetime low earners. In 2023, a lifetime low-earning worker with 30 years of coverage can do no better than a $1,033 benefit check every month. That is below the federal poverty limit of $1,215 per month for a single filer this year. So under Biden's plan, the special minimum benefit would be boosted to 125% of the federal poverty level. If this were law right now, the special minimum benefit for 30 years of coverage would be $1,518 per month. Finally, Biden has called for a gradual increase to the primary insurance amount for aged beneficiaries. Under his proposal, the primary insurance amount would increase by 1% annually, beginning at age 78 and continuing through age 82, for an aggregate increase of 5%. Well, my awesome and amazing friends, that is the end of my daily stimulus update video for today. My dearest friends, thank you so much for being part of this community. To say thank you, I will be announcing several winners every Friday for the Walmart gift card giveaway. If you would like to enter these weekly giveaway, friends, please click and like several of my videos and then comment below the keyword of each video that you watch. The more videos that you comment on, dear friend, the greater your chances of winning the giveaways. Thank you, and have a wonderful and very blessed weekend.